Prior to Waterfront Recovery Services opening in November of 2017, Humboldt County had a social detox in an old Victorian home on C Street in Eureka. It was a 9-bed detox that didn't have any medical oversight, and any person who went to that detox had to be cleared through the St. Joseph Hospital emergency department first. And there was ample room for complications and problems with that scenario. The emergency department is equipped to provide life-saving intervention when that's needed. It's not a place that's set up to provide treatment for drug addiction or alcohol addiction. And so really, we need to create other places in the community that are well equipped to deal with alcohol and drug addiction, and that's what Waterfront Recovery Services is doing. We know that treatment on demand is the best course for dealing with the opioid epidemic and the other drug epidemics that we have in society today. Across the country, we know that we need more access to care. One challenge that we have in Humboldt County, and just being a rural community, is that we often lack facilities, and we have lacked that kind of investment in infrastructure and different facilities in our community as compared to some more urban centers. So John long had a vision to create a higher level of care and to transform from a social detox to a medical detox in preparation for drug Medi-Cal. The St. Joseph Hospital, through the Wellbeing Trust grant, was really able to provide that operating support to have Waterfront open its doors and to subsidize operations for the first 18 months. That grant funding has ended, and we know that there is a sustainable source of funding out there in drug Medi-Cal. However, drug Medi-Cal is not active for our community yet. It hasn't gone live. And there are several hurdles that people are working through to get it to go live: the county, the state, and the federal government. So meanwhile, in the interim, because St. Joseph Hospital believes that Waterfront is such a critical asset to our community, we're continuing to provide operating subsidy to Waterfront Recovery Services until drug Medi-Cal comes online. But that funding is time-bound. It's not going to exist forever. So hopefully here in the next few months, drug Medi-Cal will be approved for Humboldt County and the other counties on the north coast of California, and that we will have a sustainable payer source to pay for detox and treatment for addiction. The issues that are facing our communities today are big. They're significant issues, and it really is going to take all of us working together in order to change systems and to create the type of healthcare and social care system that we want for our family and our neighbors. And so I think partnerships like what Waterfront Recovery Services has done, and partnering with the county and St. Joseph Health and others, police department, sheriff's department, it really is going to take all of us working together in order to be able to address these issues that our community is facing. And I think St. Joseph Health providing support to Waterfront Recovery Services is one example of us realizing that we need strong partners in the community, and that we all have to work together in order to make this a community where everyone can thrive.